وعلى مستقبل الوكالة وعن الفرص المتاحة والخطط والبرامج التي يعمل عليها كل مدير لتجاوز هذه الأزمة. نبقى مع كلمتك أستاذ علي هويدة رئيس الهيئة 302، فلتتفضل.
شكرا لك دكتورة انتصار. ضيوفنا الأكارم كل باسمه وصفته ولقبه ومن يمثل، نرحب بكم أجمل ترحيب، كما نرحب بمتابعينا الأعزاء أينما كانوا. السلام عليكم جميعا ورحمة الله وبركاته. ماذا يعني أن تصوت 167 دولة في الجمعية العامة للأمم المتحدة على تمديد تفويض عمل وكالة الأونروا ل3 سنوات جديدة تنتهي في حزيران 2023؟ حصل هذا طبعا بعد أن تعرضت الوكالة لأشرس حملة استهداف وتشويه في تاريخها من قبل الإدارة الأمريكية ودولة الاحتلال الإسرائيلي، وخلال 4 سنوات هي عهد الرئيس ترامب. أبرزها كان قطع المساهمة المالية السنوية في صندوق الوكالة وقيمتها 360 مليون دولار من سنة 2018 حتى الآن، والادعاء بأن الوكالة فيها فساد ومعادية للسامية وبأنها تضخم أعداد اللاجئين وغيرها. وماذا تعني أن تجتمع اللجنة الاستشارية لوكالة الأونروا مرتين في السنة لتناقش وضع الأونروا، وهي المكونة من 31 عضو، 28 دولة، وثلاث أعضاء مراقبين، جامعة الدول العربية ودولة فلسطين والاتحاد الأوروبي، وتقول بأن الأونروا حاجة إنسانية ضرورية لأكثر من 6 مليون لاجئ فلسطيني مسجل وعنصر أمن واستقرار في المنطقة. والبارحة عقد مؤتمر المشرفين على شؤون الفلسطينيين في الدول العربية بدورته 105، وأكد أيضا على دعمه للأونروا. وماذا يعني أن تقيم الأونروا شبكة تقييم أداء المنظمات متعددة الأطراف، اختصارها موبان، المكونة من 18 دولة بما فيها أمريكا، وتصدر تقريرها في 10 يونيو 2019، وجزء من التقييم يثني على إدارة الأونروا القوية وهيكلها التنظيم المرن ورؤيتها الاستراتيجية وفعالية تقديمها للخدمات. وماذا يعني أن يتحدث الأمين العام للأمم المتحدة غوتيريش دائما عن دعمه الدائم للأونروا ووقوف الأمم المتحدة بجانبها، ويدعو الدول المانحة إلى تغطية العجز المالي؟ هذا يعني أولا بأن مصير مستقبل الأونروا تحدد الجمعية العامة للأمم المتحدة فقط وليس أي أحد آخر. ويعني أيضا بأن هناك دعم معنوي وسياسي دولي ساحق للوكالة. ولكن يبقى السؤال الجوهري: لماذا لا يترجم هذا الدعم السياسي والمعنوي إلى التخلص من الأزمة المالية المزمنة للوكالة إلى غير رجعة، وكذلك توسيع سياسة عمل الأونروا؟ يدرك المجتمع الدولي الذي أنشأ الوكالة في العام 49 وبعد 72 سنة هي عمر النكبة بأن الظروف والمعطيات المحيطة باللاجئين الفلسطينيين ووكالة الأونروا قد تغيرت. عندما أنشئت وكالة الأونروا اتخذت صفة المؤقت على اعتبار بأنه سيصار إلى عودة اللاجئين الفلسطينيين وفق القرار الأممي رقم 194 لتاريخ ديسمبر 1948 الذي أكد على حق العودة والتعويض واستعادة الممتلكات. وانبثقت على القرار لجنة التوفيق الدولية حول فلسطين UNCCP المكونة من أمريكا وتركيا وفرنسا، وكانت مهمتها بالإضافة إلى توفير الحماية القانونية والجسدية والإنسانية للاجئين وضع برنامج وآليات لعودة اللاجئين إلى بيوتهم بما يشمل كل اللاجئين الفلسطينيين في العالم. ولكن جرى تعطيل عمل هذه اللجنة منذ مطلع خمسينيات العام الماضي، على الرغم من أنها لا تزال موجودة في الأمم المتحدة وتقدم تقريرها السنوي في بداية شهر سبتمبر من كل عام. وبناء على تعنت دولة الاحتلال الإسرائيلي واعتبار حق العودة للاجئين من المحرمات، استمر عمل الوكالة حتى يومنا هذا. أضف إلى ذلك بأن عملية تمويل الأونروا مع بداية نشأتها بأن تكون طوعية كانت مقبولة، إذ كانت مترافقة مع مفهوم أن وكالة الأونروا هي وكالة مؤقتة وسينتهي دورها قريبا مع عودة اللاجئين. ولكن بقي التمويل حتى يومنا هذا طوعيا ويخضع أحيانا لشروط الممول. جاءت الوكالة ووفقا لولايتها بأن تكون خدماتها محصورة فقط باللاجئين الفلسطينيين المسجلين في سجلاتها في مناطق جغرافية 5 فقط. وليصبح عدد اللاجئين المسجلين في سجلاتها حسب إحصاء الوكالة للسنة 2018-2019 قد وصل إلى أكثر من 6 مليون و100 ألف لاجئ مسجل، لكن العدد الفعلي تجاوز 8 ملايين لاجئ حسب تقديرات مراكز الدراسات والأبحاث. وبالتالي نظام الأونروا الحالي بما يشمل ولايتها المحدودة ومهماتها وطريقة تمويلها لم يعد يصلح للتعامل مع مأساة اللاجئين المتفاقمة، مع امتداد حالة اللجوء لأكثر من 72 سنة وتضاعف أعداد اللاجئين وزيادة احتياجاتهم. كما أن الأونروا ليست منظمة أهلية وليست جمعية خيرية، وهي ليست مكلفة بتوفير ميزانيتها بنفسها، إنما تقع هذه المسؤولية على عاتق الأمم المتحدة التي أنشأتها، والجهود التي تقوم بها الوكالة تعتبر جهودا إضافية مشكورة. ومهم أن نكون على أبواب عقد مؤتمر يجري التحضير له من قبل الأونروا والأردن والسويد في الربع الأول من سنة 2021 لحشد الدعم السياسي والمالي للوكالة، ولكن يجب ألا تعفى الأمم المتحدة من مسؤوليتها الأساسية في التمويل. وكما نعلم فإن الأمم المتحدة تساهم فقط في 3% من ميزانية الأونروا، والدول العربية تساهم في أقل من 7% من الميزانية العامة، وهي النسبة المتفق عليها طبعا، وهذا حتما وبكل تأكيد غير كافي. الاستمرار في عدم دفع المبالغ المالية في صندوق الأونروا سينعكس سلبا ليس فقط على الأوضاع الاقتصادية والاجتماعية لأكثر من 6 مليون لاجئ في المخيمات والتجمعات، من بينهم حوالي 30 ألف موظف ونصف مليون طالب وطالبة، وهذا طبعا بنسب متفاوتة في كل إقليم من الأقاليم ال5، وخاصة في ظل جائحة كورونا المستجدة، ولكل إقليم طبعا معاناته وتحدياته كما سنرى بعد قليل. وحتما سيسبب المزيد من حالات التطرف والاستغلال، وكذلك سينعكس على الدول المضيفة وعلى أمن واستقرار المنطقة التي هي أصلا غير مستقرة، وكذلك سينعكس على الوكالة نفسها وعلى ولايتها التي ستضعف تدريجيا لتتحول إلى وكالة اسمية في الأمم المتحدة ليس لها أي مهام وظيفية مثل لجنة التوفيق الدولية حول فلسطين UNCCP. تقليص الخدمات والبرامج وتأخير رواتب الموظفين عبر إجراءات إدارية تتخذها إدارة الأونروا عمليا يمس بحقوق اللاجئين ولا يعالج أصل المشكلة أي الأزمة المالية المزمنة. وهنا لابد من التأكيد على أن الوكالة ليست خصما للاجئين وليست المستهدفة بحملاتهم وفعالياتهم الاحتجاجية، إنما المستهدف هي الدول التي تعرقل تمويل الأونروا وتضغط على الدول المانحة لنزع الثقة بينها وبين الأونروا. ونذكر هنا في نيسان 2017 على سبيل المثال كيف تم تعطيل أو كيف عطل سفير الاحتلال السابق في الأمم المتحدة نقاش دعوة الأمين العام للأمم المتحدة غوتيريش كي تكون ميزانية الأونروا كافية ومستدامة وقابلة للتنبؤ. وعاد المفوض العام لازاريني بالتذكير بالتقرير أثناء خطابه أمام اللجنة الرابعة لمقاومة الاستعمار التابعة للأمم المتحدة في أكتوبر 2020، ونأمل أن تنال دعوته صدى وقبول. لذلك لابد من أن تبذل جميع الجهود للضغط على الجمعية العامة للوصول إلى التالي: أولا التأكيد على أن الأونروا وكالة دولية ذات ولاية دائمة وليست مؤقتة، ويجب الاستمرار في تقديم خدماتها إلى أن يتم تنفيذ قرار الجمعية العامة رقم 194 وقرار مجلس الأمن الدولي أيضا رقم 237 لعام 67 الذي دعا إلى عودة النازحين بعد احتلال الضفة الغربية وقطاع غزة، وتم ضم النازحين إلى سجلات الوكالة. ثانياً جعل موازنة الأونروا الأساسية لتغطية البرامج والخدمات جزءاً من مساهمة الدول الإلزامية في صندوق الأمم المتحدة، على أن تراعي الموازنة العامة نسبة زيادة سنوية تتوافق مع نسب ازدياد أعداد اللاجئين واحتياجاتهم. أنهي بالتأكيد على مسألتين: الأولى بأن قضية الدفاع عن الأونروا وحمايتها هي جزء من حماية حقوق اللاجئين التي يحاول الاحتلال شطبها، فاستهداف الوكالة سياسي بعنوان مالي وسيستمر. وحتى لو استأنفت إدارة بايدن المساهمة الأمريكية المالية التي قطعها ترامب سيحصل تحسن، نعم سيحصل تحسن، لكن ستبقى الأزمة المالية. ومبلغ حوالي 70 مليون دولار هو العجز المالي للوكالة لهذا العام، والذي للأسف سيرحل أيضا إلى السنة القادمة، قادرة أن تغطيه أي دولة من الدول المانحة. فميزانية يوم واحد فقط، ميزانية يوم واحد فقط من الحروب التي مرت وتمر بها المنطقة وغير المنطقة كافية، ليس فقط لأن تغطي العجز المالي، ولكن لكي تغطي ميزانية الأونروا السنوية كاملة، لا بل ممكن أن يزيد. المسألة الثانية بأن من يدين قضية اللاجئين الفلسطينيين ليست وكالة الأونروا، وإنما هي الأمم المتحدة التي تعجز عن تطبيق القرارات التي أصدرتها. وبتقديرنا وللتخلص من هذا المأزق المطلوب استحضار الأمم المتحدة مشروعية حقوق اللاجئين الفلسطينيين السياسية والإنسانية والقانونية. ونحتاج نحن أيضا كفلسطينيين الدفع باتجاه تعزيز دورنا بالدرجة الأولى وعلى كافة الصعد، سياسيا وشعبيا وإعلاميا ودبلوماسيا وقانونيا، بوضع قضيتنا كلاجئين وبقوة على الأجندة الدولية، واستثمار الكفاءات التي عندنا لعدم تجاوز حقوقنا في المستقبل أمام أي معطى أو تحول سياسي في المنطقة وفي العالم. شكرا جزيلا لكم.
شكرا لك الأستاذ علي هويدي مدير الهيئة 302. نبقى الآن مع كلمة المدير الإقليم لمنطقة سوريا الأستاذ أمانيا أبي، اللي يتكلم على الظروف التي يعمل فيها في إقليمه في ظل الأزمة المالية الحادة التي تواجه وكالة الأونروا. تفضل أستاذ.
Good afternoon and greetings from Damascus. My name is Amanya Michael. I'm the director of UNRWA in Syria. I've been in Syria for nearly 4 years now. I have seen the last 4 years and the evolution of the situation in this country. I would like, before I start, to thank you all for the interest in UNRWA and our work and the Palestine refugees. We look forward to continued support from and collaboration with you. UNRWA in Syria is one of the biggest UN agencies in the country, employing 4,000 staff, and having stayed very active and engaged throughout the period of the conflict. We are about 10 years into the crisis itself. We serve currently about 438,000 refugees in Syria. Before the war broke out, we had about 560,000. A number of them left the country, 27,000 currently in Lebanon, 17,000 in Jordan, and others dispersed across the world. Of those who stayed in the country at the beginning, we had about 60% of them displaced internally. That has reduced to 40% now. 91% of the refugees live below the poverty line. That's a survey we conducted as a result of the survey we conducted in 2018. The war has had, the conflict has had an impact on UNRWA itself. 44 agency facilities were destroyed. We lost about 29 vehicles. 30% of our schools were damaged. And 3 of the 12 refugee camps where we work were also impacted. Now, this gives you the basis of the challenges we already work with. Now, recently we've had, COVID, which has also brought its own challenges. Currently, we have about 9,000 confirmed cases in the country. In the way we provide services as a direct implementer, it is extremely difficult to maintain physical distancing. The refugee camps are quite crowded. We are continuing to provide direct education in the schools, face-to-face education. We haven't been currently making sure that education continues. As a result of COVID as well, we've seen a very grave impact on the population in terms of rising prices of commodities, including bread. We have a fuel crisis in the country, which is little abated, but also now coming back. It's coming to winter. We have these challenges, and also close to 80% of the refugees say that they have been directly affected by the crisis. Against all odds, against all these odds, our staff have worked together with all those concerned to provide services. I'm very pleased to say that against all the challenges of the economy, of funding, of the conflict, we have been able to prevent the spread of COVID in the country. We have designed innovative programs that serve the refugees. We have currently 51,000 students in 102 schools with a 90% pass rate. We provide very innovative health care, and we have adjusted it to respond to the pandemic, where we are providing telemedicine and distributing medicine to non-communicable diseases into the homes to reduce overcrowding at the facilities. We have also addressed issues of mental health with the refugees, provided cash assistance and food, changed, adjusted our food to provide blanket food distribution given the socioeconomic impact of the war. Also, through our microfinance program, we've also provided microloans to the refugees and the Syrians to also help them start small businesses, especially needed at this time of the crisis. We are faced with huge challenges. Most among them is funding. Our emergency appeal budget is 28% funded only, meaning that we have only got about 30% of what we required for 2020, and the 70% is unfunded, meaning that we've been forced to reduce the services we are providing to refugees, including cash, including our ability to repair installations, and some of the support we provide to our services. There is uncertainty, as you currently know, with our ability to pay salaries to our staff, which has created a lot of anxiety. And these are staff who have been on the front line providing critical services in a very, very challenging environment. The fact that we cannot afford to pay them salaries is extremely disheartening to us as management, but also to all of us still as staff and to the refugees. This has had a grave impact on the staff, raising stress in an already very stressful environment. And also for the refugees, the challenges of limited funding means that we've reduced services. We currently may be forced to reduce services because of limited funding, and that would have devastating impact on the refugees, especially in the socioeconomic environment in which we find ourselves. And I worry very deeply that if funding was not to come, and it's extremely worrying right now, that this may impact our services, and the closure of services, including schools or clinics, God forbid, would spell disaster to the refugees and the population and their inability to cope. So we want to appeal to the international community through you and with this partnership to advocate for UNRWA to receive the funding that we need to continue providing critical services to the refugees, to pay the salaries, but also to make the funding for 2021 more sustainable and reliable, so that we are not constantly looking for funding, that we focus on the work that the United Nations, the General Assembly gave us, that you support us through your advocacy to mobilize resources to fund the rehabilitation of our infrastructure, which was damaged through the crisis. And we also support vulnerable families that may be wanting to return home. It's something that is extremely desirable for these populations. I thank you very much for your interest. I will wait to answer questions later. I would like to ask that I stop here. Thank you very much.
شكرا لك أستاذ أماني آبي مدير إقليم سوريا. نترك الكلام للسيد كلاوديو كوردوني مدير إقليم لبنان. تفضل سيدي كلاوديو.
شكرا انتصار، شكرا أستاذ علي. في البداية أود أن أتقدم بالشكر لعلي وللهيئة 302 على تنظيم هذا اللقاء لمناسبة الذكرى السنوية 71 لتأسيس الأونروا، وإعطائي الفرصة للحديث عن عمل الأونروا في لبنان في واحدة من أصعب السنوات التي تمر فيها الوكالة منذ تأسيسها. والذكرى السنوية للأونروا هي فرصة للتأمل في اللجوء الفلسطيني في لبنان. منذ بداية عملي مع الأونروا قبل 4 سنوات تقريباً، وأنا أقف كل يوم على صعوبات الظروف المعيشية للاجئين الفلسطينيين هنا في لبنان، وفي نفس الوقت على قدرتهم على الصمود والابتداع، وأن يكونوا أفراد محتاجين في المجتمع في الوقت الذي ينتظرون فيه التواصل إلى الحل العادل والدائم الذي لا يزال بعيد المنال حتى اليوم. إن دور الأونروا ليس فقط تقديم المساعدة والحماية، ولكن أولاً وقبل كل شيء تمكين اللاجئين من عيش حياة كريمة يعتمدون فيها على أنفسهم. نعلم جميعاً مدى صعوبة هذا العام، ومع ذلك فقد تمكنا من تحقيق بعض النتائج المهمة. اسمحوا لي أن أبرز بعض منها. في مجال الصحة تمكنا من الاستجابة للكورونا من خلال إعادة تنظيم العمل في عياداتنا لضمان سلامة الموظفين والزوار، ونجحنا في جمع المزيد من التمويل لتغطية الاستشفاء والفحوصات. كما جهزنا مركز الحجر الصحي في سبلين، وجهزنا مراكز آخرين في عين الحلوة والباص لمساعدة أولئك الذين لا يستطيعون عزل أنفسهم في المنزل. ونتيجة لذلك لم يحدث انقطاع في خدماتنا الصحية الأولية، ولم يترك أي لاجئ فلسطيني من دون علاج في المستشفى، ولم يصل مركز سبلين بعد إلى كامل طاقته الاستعبادية. ومن خلال العمل عن كثب مع ممثلي في المخيمات ولجنة الحوار اللبناني والفلسطيني، ساهمنا أيضاً في تعزيز الاستجابة الشاملة للأزمة الصحية، ونواصل القيام بذلك على الرغم من الأزمة المالية. لقد تمكنا أيضاً بعد بذل العديد من الجهود من توفير التمويل التقديم مساعدات نقدية شاملة لمرة واحدة. المبالغ التي تم توزيعها لم تكن كبيرة، وكان هناك العديد من الصعوبات في تنفيذ هذه العملية، ولكن استطاعت 91,000 عائلة الحصول على المساعدة. على الرغم من الأزمة المالية لم نوقف تقديم المساعدات للمستفيدين من شبكة الأمان الاجتماعي والمساعدات اللاجئين الفلسطينيين من سوريا، وتفاوضنا على أفضل أسعار الصرف المتاحة حتى تكون الفائدة أكبر للمستفيدين. نعتزم النظر في مستوى المساعدة للشبكة الأمان الاجتماعي التي نتفق معكم أنها قليلة. كما نواصل السعي للحصول على تمويل لجولة جديدة من المساعدات النقدية لمرة واحدة. وسنبدأ قريباً مشروعاً تجريبياً لنظام جديد للتأكد من هوية الأشخاص يعتمد على مسح بصمة العين الذي تطبقه وكالات الأمم المتحدة الأخرى. سيضمن هذا النظام وصول المساعدة إلى الأشخاص المحتاجين الموجودين فعلياً في لبنان. فيما يتعلق بالتعليم، في شهر آذار أطلقت الأونروا برنامج التعلم عن بعد لمساعدة الطلاب على الدراسة في المنزل خلال الاحتجاجات ومن ثم إغلاق المدارس بسبب كورونا. من أجل مواجهة تحديات الوصول إلى أدوات التعليم عبر الإنترنت، قدم مكتب لبنان بطاقات تشريج للإنترنت وأجهزة لوحية للطلاب. بالإضافة إلى ذلك، قدمت الأونروا للدعم النفسي والاجتماعي والدعم التعليمي من فريقها المتخصص. تتبنى الأونروا حالياً النهج المدمج، تطبق التباعد الاجتماعي المناسب في مدارسها بالتعاون الكامل مع وزارة التربية والتعليم العالي. ونحن على العلم بالشكاوى المتعلقة بنقص المعلمين وموظفين آخرين ونقص المواد التعليمية، ونحن نتواصل مع الرئاسة في عمان بشكل يومي لحل هذه الأمور. أود هنا أن أعبر عن أسفي لعدم تمكننا حتى الآن من جمع أموال كافية لتمديد برنامج الدعم الدراسي إلى ما يبدو نهاية هذا العام. كان من المفترض أن يكون هذا البرنامج مؤقتاً، ولكننا قمنا بتمديد خلال السنوات الماضية بفضل جهود حشد التمويل. نحن نعلم عواقب ذلك ونتقدم بالأسف الشديد من العائلات المتضررة، ولا يزال مكتب لبنان وأنا شخصياً يواصل جهوده في البحث على التمويل لهذا البرنامج، ونأمل من إيجاد حل في أقرب وقت ممكن. أيضا من الإنجازات التي تحققت أننا واصلنا أعمال إعادة أعمار مخيم نهر البارد، وحققنا تقدما في بناء مدرسة جديدة في سايدة منطقة 100، ومن المقرر إنشاء مدرسة في مكتب الرئيسي هون في بيروت. وقد تمكنا من توظيف عدد من عمال النظافة البيئية وإنجاز أعمال البناء والصيانة في منشآت بفضل مشروع المال مقابل العمل، والذي يوفر فرص العمل لمدة 40 يوم لمئات اللاجئين الفلسطينيين من لبنان وسوريا. ولكن ما يحتاجه اللاجئون الفلسطينيون حقاً في لبنان على المدى الطويلة هو الحصول على حقوقهم، بدءاً من الحق في العمل والحق في التملك. لا يوجد تعارض بين التمتع بهذه الحقوق والحفاظ على حق العودة. سنواصل العمل مع المسؤولين في الحكومة والأحزاب السياسية اللبنانية من أجل تحسين الظروف المعيشية للاجئين الفلسطينيين حتى يتمكنوا من العيش بالكرامة. في الختام، أنا أؤكد بأنه على الرغم من كل جهود الأونروا، فإن الآفاق والفرص أمام اللاجئين الفلسطينيين في لبنان لا تزال قاتمة، وستظل كذلك لفترة من الوقت، خصوصاً بالوقت الراهن مع استمرار الأزمات السياسية والمالية في لبنان. أنا أخشى أن تستمر نسبة البطالة والفقر في الارتفاع، مما يدفع البعض إلى مغادرة البلد بشكل شرعي أو غير شرعي. وأنا أخشى أيضاً من عواقب اليأس والإحباط. على الرغم من الصعوبات المالية الحالية غير المسبوقة، تظل الأونروا ملتزمة بضمان ظروف معيشية كريمة للاجئين الفلسطينيين من خلال الحفاظ على عملياتها. هذا أولاً وقبل كل شيء لأن اللاجئي فلسطين لهم الحق على الحصول على هذه المساعدة، وبذلك ستستمر الأونروا في كونها عاملاً رئيسياً للاستقرار في وضع اجتماعي وسياسي متقلب في البلد. في لبنان لا يوجد اليوم بديل للوكالة في حياة اللاجئين الفلسطينيين. لذلك سنواصل حشد الدعم السياسي والمالي. إن مثل هذا الدعم للأونروا مطلوب أكثر من أي وقت مدى. وشكرا.
شكرا لك أستاذ كلاوديو كوردوني مدير إقليم الأونروا في لبنان. وننتقل بالحديث إلى السيدة الأستاذة مارتا لورينزو مديرة إقليم الأونروا في الأردن. فلتتفضلي أستاذة.
Thank you. I hope you can hear me well. Greetings from Amman. My name is Marta Lorenzo. I'm relatively new to UNRWA, but I have to say that I am not new to the Middle East, Palestine, and Palestine refugees. I wanted to thank you for inviting me to this discussion today, and thank you to the followers that show interest on such an issue as Palestine refugees. Maybe let me also thank the government of Jordan, because if I look at our context, we host 2.4 million refugees in Jordan. Our work wouldn't be possible without the support of the government of Jordan. And it wouldn't be possible without the support from the international community, donors, and other national and international humanitarian partners, including community-based organizations on the ground. So thank you to all of them. As I told you, I'm relatively new to UNRWA, but as Claudio said, he was talking about rights. And I have to say that I take pride of the investment that UNRWA has made over the past 71 years on protecting fundamental rights of Palestine refugees. And these are the right to quality education, the right to health, the right to a dignified life. I don't think anybody can contest the type of work we are doing, because we are adhering to protect the most fundamental rights anybody can think of. And we are contributing to central pillars of sustainable development goals, bringing the humanitarian and development divide. I heard Mr. Ali talking about temporary mandate, permanent mandate. But what it is true that UNRWA is doing is that we are contributing to bridge this humanitarian development divide. And in a context that is always subject to political upheavals, what we do is people-centered. We are not here to talk about politics. We are here to protect the very rights of people. And our work over the past 71 years could not have been achieved without the biggest asset that UNRWA has, and this is its staff, which in Jordan is over 6,900 people. I cannot tell you what it is to feel the stress and anxiety that our staff feel when they don't know when and whether they will be fully paid or partially paid. This is something that frontliners, particularly in times of the pandemic, should never, ever hear it. In my short presentation today, I will focus on why UNRWA services are vital for Palestine refugees in Jordan. I will briefly mention COVID responses, but I don't want to say much more than what my colleagues have said. And I will also briefly speak about challenges and opportunities we are facing in 2021. Here in Jordan, we are operating 25 primary health centers and 169 schools. So if I look at achievements last year, 1.6 million people went to our UNRWA consultations, and over 119,000 children are registered in our schools. When someone looks at Jordan, we tend to look at it as a context that is stable, but the fact is that this is no longer valid. The Jordan context probably didn't have conflict as we have seen in other field offices, but what we see is that the socioeconomic situation has been aggravated by COVID, intensifying socioeconomic fragility and inequalities amongst the most vulnerable, and these include Palestine refugees. And let me share with you a couple of key highlights over decades of our operations. We have gone a long way. At the first influx of Palestine refugees in the 50s, the agency started mass distribution with basic items like flour, rice, fuel. By the late 70s, we moved to cash subsidies. Now, We are supporting people with cash-based transfers. That's using a more dignified approach that gives people the choice on how they want to spend the money. This is not something unimportant. Yesterday, I was visiting in Baka camp, one of our social safety net cases, who told us that this allows them to pay electricity or water bills. Microfinance services, they started in 2013. Now we are providing more than 12,000 loans. We are talking once again about self-reliance, dignified lives that do not contradict the right to return, as my colleague Claudio has mentioned. Our approach to health is patient-centered. Through our family health teams, we prioritize long-term provider-patient relationships and quality of care. We have recently introduced innovations and efficiencies such as the e-health system and mobile applications. These are working beautifully, and much more so in times of the pandemic when people cannot access clinics. And I don't need to explain to you why education matters, and more so in a context of protracted displacement. Every year, 10,000 students graduate from our schools. This is probably the more powerful tool we can provide to future generations. We know that the quality starts with education. Our focus is not only knowledge. We provide spaces for students to think critically and interact with other students and the community. And in Jordan, the same as other field offices, we are responding to the changes in our context. And these are mainly the Syria crisis and COVID-19. There are 17,500 Palestinian refugees from Syria. And of course, COVID-19 is affecting both Palestinian refugees, Jordanians, and others alike. This includes, when we talk about the most vulnerable, who do we mean? We mean mainly Palestinian refugees without Jordanian citizenship or facing legal status issues. And these are many of them Palestinian refugees from Syria and ex-Gazans who fled Gaza to Jordan during the 1967. We provide them with cash-based transfers and support them with other emergency needs. During this pandemic, we have seen that the most vulnerable are also women and children in particular, because they are further exposed to protection-related risks. We have established gender-based violence hotlines, and we are strengthening our referral system. I think this is indicative enough of why UNRWA services to Palestine refugees are vital and critical. And let me tell you that when I first joined UNRWA, the first activity that I ever did was to go with the Commissioner General to one of our schools, Al-Nusha. And we met with a child who told us that her biggest worry at the time when we were implementing blended learning, so not all children were at the school, her biggest worry was not COVID. Her biggest worry was not to get infected. Her biggest worry was the rumor she had heard that services might be interrupted and that she had no school to go to. Hearing this leaves us with no words. And I have also met, as part of my introductory meetings, Palestinian refugees from Syria who feel extremely frustrated because our emergency cash is based on what we can afford to do and not what the needs are. I think this is important to highlight. Our June survey showed that 90% of Palestinian refugee respondents did not have enough cash to sustain their family for more than 2 weeks. I think this statistic is alarming enough. I'm not sure I should be going into what we have been doing in the COVID-19 response. It's very similar to what other colleagues have mentioned. I think our priority has been to make sure that our services, whether they are health, education, relief, camp improvement, infrastructure, replacing schools, etc., continue. We haven't stopped not one day in providing services, and we have adapted. But adaptation and innovation comes with a cost. For example, blended learning initiatives are more expensive to run them But do we have any other choice? Do we want to leave Palestine refugees behind? We have to remember that our curriculum in UNRWA schools in Jordan is exactly the same curriculum as the one of the government of Jordan. And we do not want to have different standards for different children. Maybe something else that I wanted to mention is that in terms of the pandemic is that needs have not remained the same. We have noticed, for example, that we need additional teaching personnel, including temporary staffers, to be able to meet quality standards and adjust to a more unpredictable context where people and teachers get sick. And unfortunately, we lost 2 of our teachers. And we need to be agile. And one cannot be agile when our resources are constrained. For example, this pandemic and long-term school closure, we know is having a significant impact on the students' physical and mental well-being. And we also know that the pandemic has created a big technological gap. 32% of our children do not have access to internet or tablets or any other devices, but we do not have the agility to be able to address this gap. In closing, let me address briefly some of the challenges that we are facing. As Palestinian refugees in Jordan are entering the 5th generation, what I would want to stress is that challenges have become multidimensional and much more complex, including poverty, protection risks, and concerns around the legal status of Palestinian refugees in Jordan. Demand for UNRWA's core and emergency services is increasing. Mr. Ali said it at the beginning of his intervention. However, financial resources are at the levels of years ago, while our financial needs have increased. If we want to protect these years of investments in human development, and I want to highlight the word of human development, what we need to do is ensure that responses are inclusive, comprehensive, and coordinated, leaving no one behind. This requires not only additional financial resources, but also integrated approaches which UNRWA within its mandate cannot address alone. No single agency can address these multidimensional needs alone. And of course, we have to strengthen partnerships to help and sustain past investments in essential sectors and address new challenges. These partnerships need to be built based on the principles of complementarity and equal access to services for all. And last but not least, the Palestine refugee crisis is protracted, and UNRWA's core costs are absolutely predictable. We know what our services cost. They are unlikely to decrease without this impacting negatively on the quality of the services that we are providing. This is something that Amani and Claudio said. While we continue adjusting our programs, including innovations, and making the money go further, we need predictable and sustained funding to prevent any shocks in service delivery to Palestine refugees while continue investing in our staff. Thank you very much, and I'll be happy to answer questions later on. Thank you.
شكرا لك أستاذة مارتا لورينزو مديرة إقليم الأردن. أعطي الكلام الآن للسيد ماتياس شمالي مدير إقليم الأونروا في غزة. تفضل أستاذ ماتياس.
Thank you very much, Dr. Intisar, and let me, like other colleagues, start by thanking Ali Wadi and the Association 302 for putting up this seminar. With greetings from Gaza, let me also give a brief outline of what UNRWA does here. And maybe the first point to start with is just the simple size of UNRWA. We are the only of our 5 fields where the majority of the population are registered refugees with UNRWA. So out of the 2 million people living in Gaza, at least 1.4 million are refugees. So UNRWA has responsibility as per its mandate for 70% of the population. And that then means in terms we run 277 schools. We have 13,000 staff here. And sometimes people, when they hear that, they say that's typical UN, a big bureaucracy. But in fact, if you run 277 schools for 287,000 children, you need teachers. So 9,000 of our staff roughly are teachers, are school principals, are education specialists. We run 22 health centers, and each quarter alone, there's over 1 million primary healthcare consultations that take place in these health centers. So we are arguably the biggest primary healthcare provider in Gaza. And it goes without saying, if any of these services collapsed because of UNRWA's financial crisis, the impact would be huge for the 1.4 million refugees, of course. It would be very negative for the stability of Gaza. You would have 287,000 children without education at home or on the street. And it would be bad for the stability of the region. We truly are, in these terms, through our massive service provision, a factor of stability. Secondly, let me briefly touch on the recent few months in terms of COVID. And like my three colleagues have already outlined, in Gaza too, we've adapted rapidly, we've innovated, and I think it is a major success that our services have continued despite lockdowns, despite movement restrictions, despite the financial crisis. And to highlight a bit, ever since the local outbreak of COVID became clear or known at the end of August, day 2 after this became known, we continued sanitation services, cleaning the camps. We very quickly adapted our massive food operation. We provide food to over 1.1 million people. So that's a huge operation. And in the second quarter of this year, we adapted this operation because of COVID and brought food home to all 1.1 million people. That was a massive effort, and many, including WFP, have looked at this with amazement. Like other colleagues have talked about, our health centers have provided telemedicine, have taken medicine for the non-communicable disease patients home. And what may be important, and this shows how, while we're not on the front line in the COVID response, we play an important part in fighting COVID. We have, in emergency periods, put our primary healthcare services also to non-refugees, just for the emergency period. So this is not a widening of the mandate. This is an agreement with everyone involved, including the host authorities, that the public health hospitals need to continue focusing on the COVID response, including, of course, for the Palestine refugees. And UNRWA, in a sense, keeps their back free from this by taking on all primary healthcare work. On education, as my colleagues have all three talked about, we have also switched to a form of blended learning for a while. And right now, because of the increasing numbers of infections, it's all remote learning. One thing we've done here, which I thought was a fantastic initiative from our education colleagues, was to bring not only all school books to children at home, or to ensure they have them at home, but also accompanying learning materials. We know how difficult it is to rely on the internet and on electronic means in a context like Gaza. So we think that a major contribution is being made to keep perspectives for children alive for the future by not just depending on the internet or WhatsApp groups, but by actually having hard copies, printed materials that will take them through the education process. And every month they bring the filled-in education materials back to the school. The teachers collect them and mark them and give them feedback. And of course, delivery of school books and the collection of learning materials is all done in a COVID-safe manner. And as Marta has spoken about, this costs extra in terms of cleaning materials, security, and public health safety. And then finally, in terms of also saving a bit of time, I would like to, like my colleagues, echo that this is about far more than a financial crisis of an institution. Of course, as staff, we are particularly worried about this. Sometimes staff feel, I think, that we as management single them out when we start talking about we cannot pay salaries. But the fact is, the staff are the service. So for me, there is no separation there. Our service is teachers teaching. Our service is doctors treating people who have illnesses. So we are not talking about cutting salaries. In fact, if we do not have enough money, our big cost item of service provision is the salaries. And that's why that is so much in focus. What we are really talking about is that we would not be able to provide services. And that, as all my colleagues have spoken about, creates huge anxieties amongst staff and amongst the larger refugee community. And maybe as a final thought on this, in terms of echoing again that this is not just about the survival of UNRWA, but it is about the question of Palestine. When our Commissioner General visited recently for the first time, a prominent civil society actor said, for us, UNRWA is the question of Palestine. Everyone has to understand that. And if you want to solve UNRWA's budget problems, you have to create a just solution. That is the way to solve this. And as I often say, I would love to be the last UNRWA director in Gaza, not because we are out of money, but because we are no longer needed, because Palestine refugees have a place they can call their home and return to. Thank you again.
شكرا لك أستاذ مات الشمالي، مدير إقليم الأونروا في غزة. نبقى الآن مع الأستاذ سوني جاتنتز، نائب المديرة بمنطقة الضفة الغربية، ليتكلم عن التحديات التي تواجه الأونروا في ظل هذه الظروف الصعبة. تفضل.
Thank you very much. Thank you very much for having me and for hosting us tonight. And of course, to everyone who has linked in to this webinar, it's a great honor to be able to speak to everyone and hopefully also get some questions. I'm sorry about my name. It can be a bit of a challenge to pronounce it, but I think you did very well. So thank you so much for that. I'm the deputy here in the West Bank office. Our director, Gwyn Lewis, is away at the moment, so she entrusted me with the task. And I'm, as I said, very happy to be here. I really can only echo what a lot of, or what my colleagues have said before me. Of course, there are differences in context. The West Bank is not like Gaza or like Lebanon or like Jordan. But of course, in the end, we are one agency and we have one concern. I think Matthias said it very, very well, that UNRWA is much more than an agency, than a refugee agency, and therefore the financial crisis of UNRWA is much more than the financial crisis of a UN agency. Like in the Gaza Strip, UNRWA in the West Bank is servicing a very large percentage of the population. Around 270,000 refugees live in our camps, in the 19 camps that UNRWA is serving, out of approximately 850,000 registered refugees in the West Bank. What's important to remember, of course, is that aside from the mandate, and this is again back to what my colleagues were saying, UNRWA is really also part of the fabric, right? We, like elsewhere, those that deliver the services of what UNRWA does are people from the camps, of the camps, and they are refugees themselves, many of them. We have around 4,000 staff working in UNRWA in the West Bank, that aside from, of course, spending their time on providing services to people in real need, themselves, of course, also inject economy into the West Bank, help with the development, etc. And if you imagine that this agency was going to stop providing services, of course, aside from all of those that depend on the services, we would also then certainly see a huge injection of cash into the economy that would go missing. So again, it is one of these very rare agencies that does so much more than just what's in the actual mandate. And we really can't forget that. And I think that's across the fields, even if they are all different from one another. We, of course, provide the same kind of services in the West Bank as being provided elsewhere. Predominantly, it's around education to children. So we have around 40,000 students. We have 46 schools that we are servicing, so not quite the same numbers as in the Gaza Strip. We provide healthcare to refugees that are registered. Most of the healthcare services are provided through our health centers, but we also run one hospital in Kalkilia that services the community and has been there for a really long time. We provide relief services to those that are the most poorest amongst the refugees. And of course, in addition to that, within the camps themselves, we provide environmental services and garbage collection, solid waste management, etc. And then I think, again, also we have to recall that the situation in the West Bank is very much a situation of the protection crisis. With the ongoing occupation, UNRWA provides a presence and a service, a protection service towards people there by having teams on the ground that observe what is going on, that register what is happening, the protection, the issues that the refugees are facing with the occupation, be it through settler violence, be it through demolitions, or be it through incursions into the camps by ISF. The fact that UNRWA is there helping to provide at least testimony and witnessing what is going on is extremely important, particularly at a time when protection agencies in the West Bank are rapidly decreasing their presence for various reasons, including visas, etc. So it is really critical. We've seen, as many of you I'm sure are aware, quite an increase in the number of violent incidents between settlers and refugees and West Bankers in general. The number of demolitions in the West Bank are at an all-time high. Generally, the level of incursions into the refugee camps remains also very high with civilian casualties, etc. So once again, we had to recall that this is not a stable context where UNRWA is providing services until there's a political solution. It is an ongoing context of conflict, of tension, of violence, where people live and try to exist. And on top of that, of course, we've seen COVID, as is the case everywhere. And COVID has provided just a tremendous amount of additional challenges to people's livelihoods in the West Bank, whether you live in the camp or you live out in the communities outside. And as elsewhere, UNRWA has had to think on its feet, to adapt and to adjust and to improvise so that we could continue the services to the people in the camps. And this has been our priority this year. We have deviated from all our grand thinking about plans and ideas to just making sure that we can continue the services, that we could get the children back in school after the summer break, that we could continue the healthcare services in Kalkilia Hospital or the healthcare centers, to make sure that even if we, like everyone else, are affected by COVID ourselves, our staff, that we can continue to provide these vital services to those most in need. So we have done that, and I say with quite some pride, we managed to get and maintain the children back in school since September, when the schools opened again. We have had to constantly adapt to the PA, of course, and to their direction. But our main focus has been to keep our schools open as much as possible, bar the occasional closure because of infected staff or infected students. But we have managed. And that, of course, in itself is, I would say, a tremendous achievement, because it provides a degree of stability and continuity to these tens of thousands of children and their families that are already going through an extremely challenging time because of COVID and the general circumstances. So that's been one of our main focus. At the same time, we've also acknowledged that we need to adapt to the situation and increase our service level within healthcare to make sure that we can reach those most in need that may not be able to move around as much, partly because of closures, partly because, of course, they may all themselves be extra exposed to infection. So we have upped our ability to provide mobile healthcare services, for example, and reach out to communities rather than them coming to the health centers. We will continue with this. I'm not going to go through everything that we have done, but I would just say, like my colleagues, that this year has been one of having to think on your feet to make sure that the services do not stop. And then on top of that, we of course have the financial crisis of the agency, which I think is a financial crisis that is very well reflected in the world. It's not just UNRWA that is going through a financial crisis. The United Nations in general is going through financial crisis. And we have to remember that going into 2021, it's not just about bringing money to UNRWA. There are millions of people in need around the world, and everything has to be put into context. That's not to diminish the importance, I think, of UNRWA, but it's just to remember that there are a lot of people who are dependent on humanitarian and development services around in the world, of which, of course, the Palestinian community is a significant chunk. In the event that we fail to raise money, that we fail to get out of this hole, it will, of course, have impact on our services, however little we want it. There's no doubt that it will be incredibly difficult, if not impossible, to maintain the service levels that they're at now if we don't have the money to do it. So that means that our healthcare centers will have to be affected. It means that our education services will be affected. It means that we will have to prioritize who amongst the children should not go to school, who amongst the healthcare centers, or which amongst the healthcare centers should have diminished services, who amongst those that are the poorest of the poorest should have their cash assistance taken away. These are the kinds of decisions that we will have to face in the event that we don't manage to raise funding. And of course, it's not just for 2021, but it's also beyond, until there is a political solution. So again, we are going into a really difficult time, and I think we have to be really honest about it. We have to rely on each other's abilities to advocate and to reach out and to try and convince the donors and others how important this is, because it is important. But we can't pretend that this is going to go away, because this is a long-term issue that has to be resolved for a long period of time. There has to be predictability in the funding to UNRWA. We can't just go on month to month, year to year. We need much more financial visibility and predictability than that. Thank you very much. Again, I will end it there, and I hope that there are questions for us, and I look forward to them. And again, thanks for having me and in this distinguished panel of the UNRWA colleagues.
أكيد شكرا لك أستاذ سوني، نائب مديرة إقليم حضرة المدراء الكرام، أود أن أطرح عليكم بعض الأسئلة. لقد وصلتنا أسئلة عديدة حول عملكم، لكنني اخترت سؤالا لكل إقليم من الأقاليم، فأرجو أن تجيبوني عليه. أود أن أوجه سؤالي الأول إلى الأستاذ أمانيا آبي، مدير إقليم سوريا. أقول، أو السؤال الذي سأطرحه والذي وصلنا هو: هناك تحديات كبيرة أمام الأونروا في سوريا، ومن أهمها العمل على عودة اللاجئين الفلسطينيين إلى مخيم اليرموك. ما هي الخطوات التي ستتبعها الأونروا في ظل الأزمة المالية التي تعيشها؟
Thank you very much for that question. Before the crisis, Yarmouk was home to 160,000 Palestine refugees, and about the total population was 1.2 million, but of that, 160,000 were Palestine refugees. As a result of the crisis, about a big percentage of the camp is destroyed. About 70% of our facilities are damaged. I was actually in Yarmouk camp last week with the resident coordinator of Syria, Mr. Imran Riza, and the GAPA representative and the governor office staff. We did tour the camp. The camp is extensively damaged as it were. However, the government has started registering people. The governor visited on I believe on the 8th of November, and they've started registering people with the possibility of them returning to the camp in the coming near future. Now, on our side, we have been discussing with the Ministry of Foreign Affairs, the Governor's Office, and the GAPAR, the General Administration for Palestine Arab Refugees in Syria, asking that our priority would be to rehabilitate our installations, schools, clinics, and community centers, if the refugees are allowed to return. Now, we also need the government to install water, electricity, sewage system, which were damaged, and also to allow the refugees to come and approve that and announce it publicly. Then we will then be able to invest. Now we are still waiting for the government to make that very formal. The return process seems to be underway. We understand from the municipality, the governorate rather, that a budget has been allocated for water, sewerage, and electricity. And when that is all formalized, we will certainly launch an appeal on our side to raise funding to rehabilitate our own installations. We are already providing services inside Yarmouk. 3 days ago, you may have seen, I posted something on Facebook today. We have provided food and non-food items for refugees inside Yarmouk. We are providing health services inside Yarmouk. So we are already serving people who are in Yarmouk right now. And we wait for others to return, the infrastructure to be repaired, and then we will use all these conditions or changes to raise resources to rehabilitate our installations and support refugees also to rebuild their livelihoods. Over.
شكرا لك أستاذ أمانيا. أوجه سؤالي الآن إلى السيد كلاوديو كوردوني، مدير إقليم لبنان في الأردن، في لبنان عفوا. بالنسبة للبنان، قطاع التعليم من القطاعات المهمة. يشهد اليوم هذا القطاع تراجعا في الأداء، خاصة بعد التعليم المدمج الذي يجمع فيه عدد كبير من الطلاب، مع ضعف في الإنترنت وعدم توافر الحواسيب مع جميع الطلاب. كما يشهد هذا القطاع اليوم تقليص في عدد المعلمين والاستغناء، وطبعا بحسب ما يذكر بسبب الظروف المالية التي تعيشها الأونروا. ما هي الخطوات العملية التي ستتخذونها إزاء هذا الأمر؟ تفضل أستاذ.
شكرا. راح اجيب بالانجليزي اذا ممكن، اسهل عني. So the question, sorry, there was an interruption, but the question is about how we're dealing with the online teaching and so on in the current circumstances. So at the moment we are employing, and we first of all we need to identify how many teachers are going to be how many students are in our classes, because we had many times the school started and stopped. We have we need to see who comes to the classes and who logs in online, so that we can have a definite number of students. We know that this year we got more students than last year, mainly because many people have left. They may have been in Lebanese public schools or in private schools, They came to us because they can no longer afford being there. But we don't know still exactly the number of students. However, we have started the year. We have more than 1,400 teachers, and we're getting ready to add to these numbers those that are needed, despite the economic, the financial crisis that we have. This is again because we don't want the crisis to impact on our services. And so even though we are not there yet, we have about maybe 50 teachers that are missing, we are working to ensure that that takes place. And you heard me speaking about the program of learning support that we're trying to rescue. And I hope that in the coming days, after many contacts with many donors, we may be able to have some good news in that respect. Unfortunately, as you know, the situation in the camps or the situation in houses that are overcrowded anyway makes it very difficult for children to be able to learn online. This is why we try to provide additional devices to some of the families. We still have plans to do that, but it remains a very difficult way to learn for anybody, even in rich countries, let alone in refugee camps. So in short, basically, we are making every effort to make sure that the service, the education service is maintained, and that we have all the teachers we need, and that hopefully we can move away from this COVID restrictions, although I'm afraid that I think this school year will still be dominated by, at best, this blended approach rather than having people going back to school as they should. Thank you.
شكرا لك أستاذ كلاوديو كوردوني مدير إقليم لبنان. سؤالي إلى السيدة مارتا لورينزو بالنسبة للأردن. تعيش الأونروا في الأردن أزمة مالية تؤثر بشكل كبير على خدماتها المقدمة للاجئين الفلسطينيين. ما هي الطرق التي تساهم في تجاوز هذه المسألة أو هذه الأزمة تحديدا؟
Thank you for this question. I think at the very end of my intervention, I mentioned that the challenges for Palestine refugees have become more complex. This is with or without UNRWA's financial crisis. So I would say that even if we didn't have the financial crisis that we are seeing right now, my answer would probably be the same. There is no single agency that would be able to address these challenges alone. So we have to build more partnerships. And we know that we have sister UN agencies that are complementing the work we do. We know the essential role of the government of Jordan in the provision of services. I'm just going to give one example related to the pandemic. As we have seen since September, growing community transmission, we have advocated for the expansion of PCR testing in Palestine refugee camps. This is now happening. So soon we will be having PCR testing in Palestine camps. This is something that is not within UNRWA's mandate. We are not prepared to do it, but through a very strong partnership with the government of Jordan, we will be able to do it. As we are preparing for vaccination against COVID-19, that partnership is going to be needed as well, and we will be part of three areas in which vaccination centers will be done through UNRWA clinics. So I think that's very important as just one example, but not the only one. If we look at, for example, how to address poverty, we know that the social protection systems have their limitations, that there are many more challenges than just being able to pay basic needs, that there are protection challenges for families that have children with disability or women-headed families. We need others to support us and to be able to refer those cases so that they are treated in a holistic manner. And we need to do it faster and better. So I think that is very, very important. And then what would help us manage the crisis is to use the different funding mechanisms that we have in place to use them the way they were designed for. As I mentioned in my previous intervention, we know what the costs of running our education system are. We know that we need over 4,000 teachers. So this is predictable. What it is not predictable is needs related to COVID-19 and emergency cases to a certain extent for Palestinian refugees from Syria have become more predictable. But one would argue that it is unclear what this would cause. So for that, we have emergency appeals. So we encourage our donors and supporters to use the right mechanisms to be able to address the different needs that the agency has. And part of the needs are also replacing very old infrastructure or rented infrastructure. I visited one of the rented schools of UNRWA in South Amman, and this is not acceptable to have children learning for years and years in rented premises. So of course we need investments in infrastructure that eventually would help us save money, because the moment we stop renting premises and putting children in the right adequate spaces for education, we will not only improve education, but we will also save costs. So thank you. I hope that answers your question.
شكرا لك أستاذة مارتا مديرة إقليم الأونروا في الأردن. أوجه سؤالي الآن إلى السيد ماتياس شمالة. بالنسبة لغزة، غزة تعيش تحت خط الفقر المدقع لغالبية سكانها، أو يعيش غالبية سكانها تحت خط الفقر المدقع، حيث هناك ضعف في الاستشفاء، انعدام الخدمات الطبية الضرورية تحديداً وخاصة في ظل وباء كورونا. فما الخطوات التي ستتخذها الأونروا في هذا المجال، خاصة كما قلت في ظل أزمة كوفيد-19؟
Yeah, thank you very much. I think our priority remains, as I think all colleagues have talked about, to keep our basic services going. So that is to keep education going, to keep our primary healthcare centers going, to keep our massive food operation going, and to provide sanitation. I think that's the biggest contribution we can make. And as I outlined earlier, in emergency periods, we also provide services to non-refugees on that primary healthcare side, so that the hospitals can concentrate on the COVID-19 response to everyone. So that's one bit. I think a second bit, and that's where this afternoon's webinar is important, is advocacy. You know, the reason things are so bad in Gaza, including the reason why the hospital sector has collapsed basically in terms of its infrastructure, is that we are in the 14th year of blockade. You know, so we need to advocate with the international community, not just for, of course, in the medium to longer term, or as soon as possible, an overall just solution, but to lift the blockade. People do not need to be unemployed here. If the blockade were lifted, we know that many people would find jobs, would be less dependent on UNRWA and the international community. So I think we really together need to raise our voices in both the medium-term perspective of a just solution is needed, but Gaza specific, it is about lifting the blockade. You know, in my first or second week here, a bit more than 3 years ago, a senior advisor of mine, a Palestinian, said to me, we all know this famous Chinese saying, it's China, that it's better to teach people how to fish than to give them fish. And he said to me, and that stuck with me, in Gaza, we don't need to be taught how to fish. We know how to fish. We need an opportunity to fish. And I think that's out very well. Thank you.
شكرا لك أستاذ ماتيس. أوجه سؤالي الآن إلى الأستاذ سوني، مدير إقليم الضفة، أو نائب مديرة الضفة الغربية. تواجه الأونروا تحديات التنقل عبر حواجز الاحتلال لموظفيها ولطلاب المدارس على وجه الخصوص، بالإضافة إلى التهديدات الدائمة من قبل الاحتلال بإلغاء عمل وكالة في شرق القدس المحتلة، وإن هناك تدخلات في السابق من قبل بلدية الاحتلال في مخيم شعفاط واقتحام عيادة باب الزاوية التابعة للأونروا من قبل الاحتلال. ما هي خطة الأونروا للحد من تدخلات الاحتلال في شؤونها في الضفة الغربية بما فيها شرق القدس المحتلة؟
Okay, thank you. Thanks. Look, for us, the priority remains to ensure that kids can go to school, and if they can't go to school for one reason or another, then they can continue their education at home. We are currently, especially in the West Bank, we are very much following the PA's instructions and the PA's guidelines. And if children are blocked from going to school because of lockdowns, etc., we, as was also said from other colleagues, we will very much continue the best we can to expand and provide opportunity for blended learning, for distance learning, etc. And of course, it's a challenge for everyone, because it means that you need to have access to internet, you need to have access to devices. And this is something that we are working with our donors to make sure that that we can grow the number of tablets available to children, grow the opportunity for children to basically do online learning, but hopefully also blend it with an opportunity to come to school occasionally, so that they can see each other and they can meet with the teachers and have in-person learning. That's our priority. The ongoing issues around Shufat and the ongoing issues around East Jerusalem, this is very much also an advocacy aspect. We are working within the bounds of our own, but also, of course, working to ensure that the children have uninterrupted education in these areas. In East Jerusalem, we have to follow the Israeli instructions, and we have done that so far when it comes to lockdowns, etc. And we need to make sure that the quality of the education is as good as it can possibly be. We are not trying to compete with Israeli schools in East Jerusalem or elsewhere. This is not our job. Our job is to provide education to the children that come to our schools, and to do it the absolutely best we can with the means that we have, and then constantly trying to adapt to the changing circumstances. So this is really our priority, and as others have said, it continues to be a challenge. It's of course a challenge when we have people around our compounds that try to take them over or try to interfere the best that we can. And that comes down to then us negotiating and advocating with the authorities so that we can continue providing the services that the children are entitled to from the locations that are UNRWA's locations. So that's how I see it. Thank you.
شكرا لك أستاذ سوني. أشكر جميع المتحدثين. الأستاذ أمانيا آبي سوريا، أستاذ كلاوديو كوردوني من لبنان، يعني مدير إقليم لبنان، الأستاذ مارتا لورينزو الأردن، الأستاذ ماتياس شمالي غزة، الأستاذ سوني جويدنتز. شكرا لك. لكن قبل أن أعطي الكلام للأستاذ علي هوادي مدير الهيئة 302، سيتم طرح سؤال على الحضور، أرجو التفاعل معه. أترك الكلام لك أستاذ علي. أستاذ علي. استاذ علي الصوت عندك ميوت انت استاذ علي.
الصوت واضح؟
هلا واضح، قبل
تمام.
كنت عامله صامت استاذ علي. اترك الكلام لك في نهاية هذه الندوة.
اوكي، هي طبعا هي كلمة شكر لك دكتورة انتصار على إدارة هذه الندوة، والشكر لمدراء الأونروا الخمسة الأفاضل طبعا على مشاركتهم ومداخلاتهم القيمة. وأكرر السيد أمانيا مايكل أبي من سوريا، والسيد كلاوديو كوردوني من لبنان، والسيدة مارتا لورينزو من الأردن، والسيد ماتياس الشمالي من غزة، والسيد سوني جاردنتيز ونائب السيدة جوين لويس مديرة عمليات الأونروا في الضفة الغربية. والشكر على ما قدموه من ثروة من المعلومات والتوضيحات، والتي حتما سنعمل على تعميمها لأوسع شريحة ممكنة. وأعتقد بأنها قد أجابت هذه الندوة على جزء كبير من التساؤلات والاستفسارات التي وصلتنا من الأعداد الكبيرة من اللاجئين. نعم، هي تحديات ومخاطر كبيرة تواجه الوكالة، نأمل تجاوزها وبأسرع وقت ممكن وبأقل خسارة، سواء للاجئين أو للموظفين أو حتى للوكالة، وأن يكون هناك حلول سريعة وقاطعة لأزمة الأونروا السياسية والأزمة المالية المزمنة. ونعتبر هذه الندوة بما قدمت هي إضافة نوعية لمنهجية التواصل بين الأونروا ومؤسسات المجتمع المدني، وتوصيل صوت الأونروا للاجئين الفلسطينيين وللمهتمين لا سيما على مستوى الأمم المتحدة والدول المانحة. والشكر الموصول طبعا لمدير الاتصال والإعلام والناطق الرسمي للأونروا باللغة العربية الأستاذ سامي مشعشع على جهوده في إنجاح هذه الندوة. الشكر للدكتورة عبير بركات، أو الشكر للدكتورة عبير بركات على الترجمة الفورية، وعلى الجهود التقنية من الأستاذة هبة ماضي وفريق عمل الهيئة 302 بشكل عام. الشكر لكم جميعا متابعينا، وإلى اللقاء في ندوة جديدة قريبا بإذن الله. والسلام عليكم ورحمة الله وبركاته. يعطيكم ألف عافية.
الله يعافيك.
شكرا.
شكرا.
شكرا.